All right, folks, today we're going to talk about how to use fasting to your advantage, how to help it improve your health. This is a really fun topic for me because it's been something that I think we at Vital Signs have learned through just as a team working with people, and we learned from other professionals in this area. Um, and I can tell you, we sort of have like there are two camps. Unfortunately, this is almost never a good thing in the world where there turns out to be two sides. And the two sides are fasting is good, and the other side is that fasting is not good. Um, we aren't in either of those camps, or we're in both of those camps. I hope to maybe, I can kind of explain why people land on those, and probably will throughout the course of this discussion. But I will say it's our position that fasting can be a really good thing if you know how to use it. And if you don't know how to use it, or if you're not using it appropriately, it can be a negative. So we will talk through those. First, I'm just going to define fasting. Real quick, has anybody recently heard of intermittent fasting, or have a friend that's doing intermittent fasting, or you've done it yourself over the last year, 2 years in particular? You just raise your hand if you're on screen. Yeah, it's a big thing right now, which is good because it opens up the conversation to learning from a lot of people and hearing a lot of stories. But sometimes the nuances of those stories can get lost. So most of us know that fasting has really become popular in the last 5 years, particularly in the last 2 to 3. I'm going to go find. Oh yeah, what's that?
With keto.
Yeah, and a lot of times it's combined with keto. I think I'll have time to go through why that is. Why in particular do the fasting and keto worlds kind of cross over? And I think there's a good reason for it. We're going to define fasting as the abstention from calories for a period of time. So I'll call fasting anything greater than 24 hours. So any abstention from food for more than 24 hours, I call that fasting. Any abstention from food less than 24 hours, we're going to call intermittent fasting. So usually like an intermittent fast, or if someone's doing intermittent fasting, they're not eating. There's a window in the day where they don't eat. So sometimes, have you all seen this before, the 12-12 or 16-8 or 23-1? So that's your fasting window and then your feeding window. So the day is usually broken into both of those. And just as an aside, we're not really in either camp, or we're in both camps. Remember, most of y'all have been told by me, I want you to be doing a 12-12. So 12 days, 12 hours each day where your digestive system is allowed to kind of relax, and then 12 hours in which you can eat. So you're not eating at 11 o'clock right before bed, even though I know most of you have a 10 o'clock bedtime. But it's also, you probably don't want to be rolling out of bed. The first thing you're doing is eating. We could talk about that. That's not necessarily an issue, but you don't want to be doing both, eating right before bed and then eating right when you wake up. So most of us are already on a 12-12. So you could argue the majority of our clients are already doing some form of intermittent fasting. Then usually people will progress to a 16-8, which means basically they're skipping breakfast. And then sometimes it's called 23-1 or OMAD, 1 meal a day. Should have put OMAD in. Okay, any questions on that? Any comments? You'll find Facebook groups. Intermittent fasting Facebook group, 12-12 group, 16-8 group. There's a million groups for all of these. Okay, here's an outline of today's discussion. I'm going to discuss the benefits of fasting, my experience of coaching fasting, and share some of the good and then some of the challenges. We're going to go through a case study together, 2 case studies actually, and we'll talk about how to refine your fast to get better results, and then some rules for fasting, and then I'll just touch briefly on religious fasting. So that's going to be the outline. Okay, so what are the benefits of fasting? Actually, before I go to that, can anybody name, or has anybody fasted and can name some of the benefits they've experienced? Before I show you what I think the benefits of fasting are, what do you think the benefits are, or what benefits have you experienced?
It's supposed to give your digestive system a break and just digest everything that's in there and clear out, I guess.
Yeah. So I actually didn't even, on my next slide, I didn't put the digestive, but that's the biggest reason why we do the 12-12. Well, maybe not the biggest, but that's one of the big reasons why we do the 12-12. Yeah, your digestive system should not be working around the clock. So a fast gives your digestive system a break, which is really good for you. But yeah, Jane, perfect. Anything else?
Fast weight loss.
Okay. Yeah, I like that you put the word fast in front of that. Fast weight loss. Did you mean fast as in speed, or just like this
And
is
speed.
okay? Yeah, yeah.
Speed.
Yeah, I would say speed. Okay. Anything else?
To learn self-control.
I love it. Yeah. That I think is in my experience, the biggest benefit that fasting brought to my life was behavioral, or I might even say spiritual. So that is a huge thing that, again, I did not put on the next slide, but I love where your head's at. Yeah. In my experience, that would be why I would fast. What is actually not for the physical benefits, but for the spiritual or behavioral benefits. The biggest reasons why I'll say the benefits of fasting are the short term. At least sometimes there are some long-term benefits here, but the short-term benefits of fasting are remarkable. They're unlike any other kind of medicine that we have, specifically in regards to blood pressure, blood sugar, cholesterol, body fat, insulin resistance, even healing from infections. There's some good evidence. You know, people had like trauma head wounds and they practiced fasting and their head wounds healed faster. So there's even some immune benefits, at least short term, to fasting. Although if you're, fasting is always considered short term, because long term fasting would be starvation, and nobody's arguing starvation. So, and you can even see this on like, what kind of blood work do you take at your annual physical? Usually in the morning at 9 a.m. What is it, Nancy?
I always do mine in the morning, so I can
Well,
eat
what is it?
breakfast.
What's the adjective they put before it?
Fasting.
Yeah, fasting blood work. And so why is that? Why do you take your fasting blood work? For your glucose, your blood pressure?
Sugar, vitamin D, cholesterol, the works.
But why do they want you to take that fasted?
So you're reading what we affected by what you've eaten.
Yeah, exactly. So if you go take a fasted blood work, but you've eaten breakfast in the morning, you're going to look diabetic, basically. Because as you fast, blood pressure, blood sugar, cholesterol, insulin all go down to a normal baseline. So even if you've been a diabetic, or you've been very overweight for a couple of decades, if you fasted for a day or two and went and took your lab work, you can very often get a lab that looks exactly like mine, or a young, healthy, fit person. So there's almost no effect as powerful on that whole metabolic panel as fasting. So here's one example. This is a really interesting study where they took people with severe hypertension, so high blood pressure, and they had, I had the number in here, but I guess I didn't screenshot it. They had 175 consecutive patients do like a 3-day water fast, and all of them normalized their blood pressure within 3 days. So, I mean, there's no other tool that we have like that that's that powerful. So
food is bad.
Okay, I love it, Nancy. We're gonna get back to that in just a second. That's almost always the initial conclusion that people have. This is all that, so yeah.
This is logic.
Right, it's just natural. Yeah. Cindy Lou, what were we saying?
I was going to say, but that's not, day to day. You're not going to fast with water for days on end. So you could bring it down, but that's not your regular habit of eating or living. So I don't think that's relevant.
Yeah, so I would argue it's not as relevant as that, but it is, I would say, relevant. There is, and there has been demonstrated that in the appropriate dose, you can have long-term improvements in some of those markers. So it's too simple to say, well, why doesn't everybody with high blood pressure just fast? Well, because, obviously when they go back to food, you've got to do that in the right way. And so I'll touch on that in a second. But it does show that there's a dose there that really can be powerful. And I do think if you do it appropriately, it can have long-term results. And I've seen it have long-term results. So But I love that, Nancy, because it's like, well, like oftentimes people do have a framework that, well, I guess then just food is bad, because I need to lose weight or because fasting is good. And
Reasoning.
yeah, I know you kind of said that as a joke, Nancy, but I've heard that so many times, and I've worked with so many people that really do act as if they believe that. So I want to help you not believe that and make sense of it.
Mm.
Okay, so here's my experience coaching fasting. Here's some of the good things. Patients do really get a great initial result, and that's not, Cindy Lou, even if primarily somebody does a fast and they get a short-term benefit from it, if you have them on a path to where they can continue to get long-term results, that's not necessarily a bad thing at all. In fact, it's almost universal that behavioral interventions, whether it's using a new app or you're working with a new business within your business, like if you get fast results, people stick with it, and it's really encouraging. So don't underestimate how powerful that encouragement can be. When you can get someone and they can reduce their blood pressure med in a week or a week and a half, as long as you can maintain a pretty good result on the back end, that initial result can be really powerful from a behavioral standpoint. So that's a good.
Should you ask your doctor if it's okay for you to fast?
Yeah, so I've got that I've got that before this presentation's over.
Okay.
That would definitely be one of the things that I feel like we've always done that, but that we've learned as well. So a lot of times people feel really great when they fast. Some people feel not good, but I think that's actually a minority. Most people don't really feel hungry, and they feel like they got a lot of energy, at least for the short term. It's very often that you can begin to remove someone's meds under obviously medical supervision. And then a lot of times those meds can stay off as long as you recover on the other side. And then from an adherence standpoint, it actually, think about how sometimes it can be such a challenge to go to an event and you're not really sure what you're going to eat, or maybe you're kind of trying to track your food, but you're estimating, you don't really know what you're eating. On one level, most of the people that I've fasted or that have fasted have said, honestly, it was pretty darn easy. I didn't have to worry about what I was going to eat. I just kind of, woke up and went on with my day. I saved time. I saved money. I didn't have to make any decisions. So that, that's again, something that it's relatively easy to adhere to as long as you don't have really big hunger pains, which I would say most people don't.
Or headaches.
Or headaches, which that's more common than hunger pains, is the headaches. But usually if you balance your electrolytes during it, you can minimize that. Okay, here's some of the challenges. One of the things that I have noticed is, and this happens if a client first experiences good weight loss with almost anything. So some people's body really responds that the minute they start exercising, they lose, 5 to 6 pounds in like 2 weeks. Some people, if they just start and they just really get with the program, they lose weight at the beginning, or definitely with fasting, people can just come to expect that if they're doing the right thing, they're going to lose 4 to 5 pounds in a week. Even if you don't think that's how you're thinking, that is a very powerful assumption that can be working in the back of people's minds, that if I'm doing the right thing for my body, I'm going to be losing a lot of weight and I'm going to be losing it fast. Does that resonate with anybody? Does anyone identify that that's maybe a thought pattern that they've thought through? My clients are not the general population. You guys are much more engaged with your health, but I will say most people that I talk to have a linear relationship that if I do the right thing with my health, I'll lose weight. And then usually that's not just I'll lose weight, but I'll lose a lot of weight really fast. Does that make sense? At least could you maybe identify that could kind of be a thought pattern?
I think so, but I'm not sure that they have the right things in mind.
Right. Yeah, no, I totally agree. I think that that there's a lot of foundational work that you got to do for your body to be in a good position for weight loss to come. And remember, 95% of people fail to lose a lot of weight and keep it off. So I'll just encourage you that a lot of times when somebody fasts, they say, this is clearly really good for my body because I just lost 8 pounds. And then if their weight loss ever stalls, they'll say, well, why don't I go back to the fasting because that worked and this isn't working.
Well, then how often do you do it?
Good question. So I hate this answer generally. I'll give some general guidelines, but it really would be individualized, and it would be based on where are you coming from? Are you walking? Are you sleeping well? Are you training? Are you eating well when you are eating? And once you do those things, you can probably fast more frequently and for longer. Yeah, Donna.
If you're just doing the fasting and going back to your old habits and fasting, that's the yo-yo trap.
Exactly. And I've got a whole slide just on that, so that you nailed that. It's very easy to say fasting is a panacea and just say, hey, it's easy to become lazy and lax with the other variables to just say, well, it doesn't really matter what I eat on Friday night because I'm going to fast this weekend.
Yeah.
And so you're just kind of like, you're really not tightly controlling your variables. And it's easy to say, well, I'll lose 8 pounds when I fast, so it doesn't bother me that, I've put on 3 to 4 pounds doing it.
Like I can go ahead and sin because I can ask for forgiveness later.
Yeah, that's a good, no, that's true. Yeah. There's even a good thing can, poison is made by the dose. Okay, when I say metabolic adaptations, I don't expect everybody to know this term yet, but I do want, at some point, I want everybody to know what that term means. What specific metabolic adaptation am I talking about here?
The food you eat?
Not quite. Yeah, Donna.
BMI?
Your baseline metabolism lowers.
Perfect. That's what Nancy and Donna were both saying. Yeah, this is the rate of your metabolism. So say you're eating 2,000 calories and then you go on a diet and you're eating 1,400 calories. The minute you start eating 1,400 calories, your metabolism is going to adapt, and eventually it's going to get all the way to 1,400 if you never change it up. The more drastic that drop is, the faster you adapt. So in other words, your metabolism will slow down faster if you go down to 800 calories. It'll start to just crash. It'll slow down slower if you go to 1,600 calories. So fasting, if you do that for even longer than just a couple of days, it's hard to test that. Like, we don't have a scientific answer for how fast does it, but your metabolism will adapt pretty quickly as you're fasting. So Nancy, 1 time a month for an extended fast, 1 time a month would be plenty for probably no more than a couple of months. You asked how much would we fast, and that's just one example. And I'll show what that looks like in one of the case studies. The other thing is, if you fast too much, because of the metabolic adaptations, when you reintroduce food, it can cause a major rebound. So people can get kind of inflamed and puffy, and the scale can shoot way up right after they fast. That's a short-term discomfort, but the long-term discomfort is you can lose muscle if you fast too much and if you fast too aggressively.
This sounds, it's pretty iffy. To me, I don't think I would do it without a doctor advising me to do it and following what I was doing.
Yeah. So I would be pretty tight, and I am pretty tight with the controls that we put on a client who's going to fast. Now, Nancy, I will say, you don't have a lot of the risk factors that would, like, the people that are a good candidate to fast are those with the blood pressure, the high blood sugar, cholesterol, insulin resistance. So it's probably not worth someone who doesn't have those issues to do a significant amount of fasting. With someone with those risk factors, it's probably something that we could consider. And for a lot of people, it is something that I definitely want to consider. So, and there's ways to minimize muscle loss, and there's ways to minimize metabolic adaptations, all that kind of stuff. Now, one thing that I do want to comment on, though, Nancy, you're talking about doing it under provider supervision. It's a very common thing for providers or health coaches or programs to just make it the next step or the next recommendation when somebody hits a weight plateau. So somebody will say, hey, I was losing weight on this program. I lost 15 pounds and then my weight loss stopped. What should I do next? It's very common for someone to go to their doctor, and the doctor says, hey, now that you stopped losing weight, let's start fasting. And I would say I would not recommend that path because, you know, you need to know where is your metabolism. Maybe it's time to not cut your calories more and fast more. Maybe it's time to rebuild. So, but you'll very often hear people will say, or you'll look at people in one of these Facebook groups, you know, these 12-12 groups. Someone started 12-12, they went to 16-8, and then they stopped losing weight. And what do they say? So they've extended their fasting to 16 hours a day, and then they stop losing weight. What's the next thing that they're going to do?
Go to 23-1.
Yeah, maybe I'll do one meal a day.
Yeah.
And guess what? You may only be able to eat 600 calories in one meal. That wouldn't be surprising. And so as you're living a whole day, and you think it's not about like calories, you know, you're like, well, I eat a lot when I eat. But if you look at the whole day, you really, once you get to that one meal a day, that's something that I would only do for a very short time.
Wouldn't that make your body spike? Just all of a sudden spike when all of a sudden it has food and then go down? That doesn't seem healthy.
Good question. So I think that probably depends on the person too. I do know a lot of people that they can do a one meal a day and their blood sugar's fine. It depends though on how big that meal is and how big that meal needs to be. What we do know is if you're doing less frequent, bigger meals, so say you're eating 2,000 calories, and if you eat that across 3 meals and a snack, so 4 feeding periods, that's going to be less likely to turn into fat than if you eat it in 2 or 1 meal. Does that make sense?
Mm-hmm.
So there is a threshold to how much your body can process and productively harness in one sitting. And so, yeah, again, I would say I would be a little bit cautious, or I might upgrade that to, I would be very cautious to go to 1 meal a day. Because even if it's like, yeah, I can do 1 meal a day, but I can eat 1,500 calories in that meal. Does that seem like the best, most sustainable path you're going to get the best results in? Not necessarily. Not necessarily. I mean, it could be. I could be open to it for a specific person. But.
Well, on your other video, the last video, you're talking about I lost my train of thought. Sorry.
Hey, no worries. Wait, what was the last video again?
The one on the one that you sent me. I guess it was from Christmas time.
Oh, yeah.
Christmas and what they were eating and all that stuff.
Yeah.
But go ahead and keep talking. I'll think of it.
Oh, well, that is a good example. So when you are going to the holidays, that's one way that I've done fasting with people is they're going to the holidays and they're like, look, you know, my family's always got food out. One of the best things that you can do is set yourself, really commit to a 12-12 or commit to like a 14-10, you know, where you're not just going to roll out of bed and start snacking and you're not just going to snack later. And you just set times on the schedule where when you walk by the cookie jar during the holidays that your brother-in-law has out, you're just not going to eat it. So that would be an example where we might do a more aggressive fasting window to keep you from just snacking on crummy food.
So I know what I was thinking about. If you're eating better, more dense, healthy foods that are filling, as opposed to eating a bunch of sugar of 2,000 calories of sugar, your body's going to respond different. So I think it would matter if you're doing the 20, what those calories are. If they're going to keep you full and satiated, or you're just going to be starving between meals.
I love that. And yeah, and Jane, that's a good point about like this satiety is if you really did try to eat a 1,400 calorie meal of chicken and beans and vegetables, I mean, that's going to be like this, you know, that's going to be a really large meal. It's probably going to be hard for you to get in. So. Whereas remember, a Taco Bell burrito is like 2,000 calories and it's like this big, right? It's like as big as half of your palm, and it's your entire daily caloric budget.
Is that all fat?
What's that?
Is that all fat that would cause it to be so high in calories in such a small portion?
Usually those almost all your restaurant meals are going to be a lot higher in fat than you can anticipate, and a lot of your fast food meals are higher. Like a Big Mac at McDonald's, I posted this one time, I forgot what it is, but I think it's like 12 grams of protein and like 40 grams of fat or something.
God.
Yes, unbelievable.
And it's like, and I've had people tell me like, hey, yeah, I'm trying to get my protein up. I got a burger at McDonald's. And it's like, it's just it's not what you're eating. So
I like those hard lettuce wrap burgers.
yeah. There's ways to make it work. We've got more options than we've ever had.
They're good. If you're in a pit, you're out.
Yeah. Lettuce wrap burgers are definitely probably preferable in that. Okay, so here's a case study. Here's a client that I've worked with this happened to. This client's initial calories were 1,800 calories. They started fasting 3 to 5 days, one time per month. And they had prediabetes and were on about 3 to 4 meds. They had really great results. They removed medications, kept them off for about 6 months, decreased inflammation, lost between 17 and 20 pounds, can't remember how much, and kept those pounds off for about 6 months. Then we had a break with working together. This is not something I do as much anymore just because this can happen. We stopped working together and I told this client not to fast, but we just miscommunicated, well, by the time we got back to working together a couple months later, daily calorie intake was at 1,200, weight loss was completely stalled. And when this client would fast, they would lose 6 to 8 pounds just in the first day or two. So they would go down, maintain, and then the first day they would go back to food, they would jump immediately back up to that number. It was almost uncanny. It was like they lived at 3 numbers: starting, fast weight, end weight, which just indicated their body was just like almost completely rebellious to real weight loss at that point. It was pretty much that 6 to 8 pounds, just kind of a fluid loss. And I think the biggest thing that happened here was there was a significant amount of muscle loss, which in the long term led to the weight regain and some of those medications coming back. Now, I will say, I think the first part of this was efficacious and helpful. I don't know if it was the best way to go, but I think it was really, really good for this individual. But I think it was uncontrolled and then got a little bit too far ahead of itself. But I think it started off I think for some people this could be a good way to start. But I would control it more on the back end. This is okay. So that's what a client will look like, and a client, or what a client could look like. And a client's exercising and they're tracking their steps and they're pretty darn motivated. But let's think through, because I've had a lot of people tell me, hey, my friend is fasting or intermittent fasting, and this is what they're telling me. So if you just take kind of like a typical, like a Facebook friend or someone who's kind of read a book on it or something, again, I'm all for read books, get on YouTube, learn. But most people are going to start from, a pretty darn low calorie intake anyways. Most people do not get in the gym a couple times a week and work out their muscles very hard. And most people have a pretty low nutritional education. So when they begin intermittent fasting, it's going to look like they're going to start by skipping breakfast. And what may happen there is energy might be pretty low, but they get some good initial weight loss, something like 10 to 15 pounds, not uncommon at all. 10 to 15 pounds of weight loss. And this leads, your Facebook friend to think, hey, this really does work. What they don't see, because they're not tracking their calories, is their calories have now dropped to 1,000. And when their weight loss plateaus, they now don't feel hungry. Their energy is really, really low. They've probably lost a little bit of muscle, and their metabolism has slowed down a good bit. And so what started as just kind of a phase where they've lost 10 to 15 pounds and changed the way they dieted is going to end with them being kind of stuck, not feeling very good, and then maybe at a potential to begin to regain. This is why I don't really give half advice to friends or family members that ask hey, what are your thoughts on, I don't want to give them half of the story. And I'd encourage you to really look to the whole story as well. Yeah,
They
Nancy.
They probably don't want to sit down and listen to the whole story either, do they?
Most of them don't. Yep, you guys do
Yeah.
though, which makes y'all awesome, and I love it. But really, it's true. Most people don't want the whole story, and
Yeah.
I'll tell you what, you guys can attest. The whole story is a lot of hard work, and it is. Speaking of the hard work, let's go back to the basics. These are the foundations. So here's what I would say. Fasting can be a really important tool. And there's a couple of people who I'm thinking of in my head that are on this call and that are just are out there doing their week, that I think, hey, and I've asked a couple of people, hey, I really want you to watch this training because I think you're going to be a good candidate. So I do want to say, like, I do think it could be a really good tool, but don't miss the forest for the trees. It's one tool, but the foundational behaviors here that we know are really, really important from a behavioral and from a scientific standpoint. You got to have that consistent meal structure. You need to be able to commit to control your food and to have the ability to have a schedule that you can follow so that you're being proactive with your food. If you're not proactive with your food, you're not going to be able to be proactive with fasting. If you're just reactive with your food, if you're just reactive with your exercise schedule, you're not going to have the ability to exercise control over your health path. You need to be eating enough nutrients and energy. So you want to make sure that you're not just really, really low calorie before you start fasting. So make sure you're not eating 1,000 calories when you're about to fast and eat a lot less. Continue to move. If you don't move when you're fasting, you will lose muscle a lot faster. So sitting less, walking more throughout the whole year. And probably a little bit more during the spring and summer as the weather gets better. Strength training is a huge piece of this because you got to take care of those muscles. Remember, your blood sugar might look better in the short term if you start fasting, but if you lose 3 to 4 pounds of muscle during a fast, that blood sugar is going to go crazy when you go back because your blood sugar lives in your muscle and it's not going to have anywhere to go. A consistent sleep schedule is still really important. Over the course of a year, if you're sleeping really poorly, your health is going to be much different than if you're consistent with your sleep. And then learning from mistakes is big here because everybody is going to respond a little bit different from fasting. So I'd encourage you to kind of track some of your variables, track your bio feedback, and see how you can refine it. Every person that I know that successfully fasted tweaked things, changed their schedule, changed their frequency, and was kind of diligent in thinking through how they felt during the process. So I can't and won't give you like a blanket recommendation, but what I'll do is we can jump on a call if you want to fast or if you're a good candidate for it, and we can start your first kind of fasting protocol. And then after it, we're going to touch base and see, okay, what worked, what didn't work, how can we do it better? So learning from mistakes and tracking and learning to grow, and that is really important as well. So here would be my rules for fasting. You need to be able to maintain training during your fast. So you should never fast. You should never over fast for your training. So in other words, if you're going to do a 5-day fast, I have some clients who I want to do a 5-day fast and who I've done a 5-day fast with in the last several months. But they had to train 4 to 5 days out of those 5 days of fasting. Because if you take that much food away from your body, if you don't train your muscles, you will lose them. So I have people, even if it's not going to be super intense, but they need to be like in the gym lifting some weights while they're fasting. If that's really a challenge for you, no shame. I totally understand. It's a challenge for me. I'm not going to be able to do that. So you're probably not ready for a 5-day fast, and that's okay. Or maybe a 3-day fast. That's okay too.
Why would you need a 5-day fast?
Well, some people want to do it for religious purposes. Some people, I've had doctors in like urgent care. Like here's an example. You just got to think of the spectrum of the people that we'll see and work with. If somebody has diabetic retinopathy or neuropathy, or their feet like are going to need to be amputated, which is very common, that you'll have so literally so much blood sugar in your blood vessels, and you're so insulin resistant, the cells in your extremities are not getting oxygen. If you're going to need to get that amputated, some specialists will say, I'll give you 7 days to fast and you might save them. And it will happen. Sometimes you can save those extremities. So that's an extreme example, but if you've got a blood sugar of 600 and you can't find any way to get it down, that might be where I would recommend that. And I've worked with folks like that. And most of the time they can go from a blood sugar of 600 down to 120, 130. So that would be extreme circumstances, Nancy, I guess is my answer. I would do intermittent fasting only paired with a diet phase and only for a set amount of time. So if your current goal, you should only be doing fat loss if you have an appropriate fat loss goal, or sorry, you should only be fasting if you know that you're in like a fat loss phase. But if you need to rebuild your metabolism and you're just starting strength training and you're just starting walking and moving more, it's hard to both increase your food intake and fast at the same time. So in other words, if you need to work on consistently eating 3 meals a day and eating enough nutrients, you shouldn't try to fast and do both of those at the same time. It's just going to be too challenging from a behavioral standpoint. Does that make sense? Are there any questions on that?
I don't know how you could eat all those calories and fast at the same time.
Exactly. It would just be by eating huge meals, and it's probably not sustainable or optimal. So here's the other thing. I ask people that they fast not for weight loss, but for disease reversal. So, or management, you could say management after the word reversal. So if your main goal, if you come to me and you say, hey, my main goal is to lose weight, then I don't necessarily think fasting is the most efficacious way for weight loss. But I do think it can be one of the most powerful ways to really get some of that blood work under control. So a lot of times I'll have a client say, hey, you know what, my weight loss has plateaued over the last couple of weeks. Can I try fasting? And my answer is almost always, I don't think that's the right decision right now. So primarily your goal should be more health than just weight loss. And by the way, that's the camp that says no, fasting is bad. They're the weight loss camp who are just about like losing weight. And they're like, hey, if you just want to lose weight, fasting is a little bit too extreme for optimal weight loss. I think there's validity to that. Oh, wait, Nancy, you're muted. Say that again.
Ask Dr. Pardue about when he fasted and he passed out at work.
I was there with him.
Were you?
Yeah. It was during a really stressful work week, which was not good planning, but it ended up being more stressful than he thought. Yeah.
Wasn't he doing some kind of test?
Well, before we have any of our clients do something, we try it ourselves.
Yeah.
That would be part of that was about 2.5 years ago, I think. That would be part of our, we weren't having people do 5-day fast really at that point, but we were learning it. So I would manage and watch medications. If you're on 2 or 3 meds, absolutely communicate with your physician before you do it, and definitely have a plan. Now the cool thing is, like, you really oftentimes I've seen people do a fast, get off a blood pressure med, and never get back on. So I mean, that's just kind of oh, Nancy, that would be another thing. Like, why would somebody need maybe a 5-day fast if they're having like extreme hypertension events and you can't get it down any other way? It's like, hey, cut it off, stop, turn the water off, let it all come back to a baseline. And this is something that I would just make a comment. This is not for anybody really that I work with, but be careful who knows that you're fasting and for what reasons. There's been a fair amount of studies, but more just like more anecdotal, is that young people probably are not great candidates to fast, especially young girls. It can turn into more of like it can turn into disordered eating, or I think, I don't like this word, but it can turn into disordered eating or an eating disorder. So I had one gentleman who was doing really well fasting, one of the best Nancy, I feel like I'm just talking to you just because you made that one, good comment. But I bet this is to everybody. But one of the best diabetes reversal results I've ever seen. Someone went from an A1C of like 12.5 to an A1C of 5, and just getting a great result. Used fasting was one of the biggest tools that this person used. He also weight trained every day of his fast. He did 6 days a month, and he weight trained, did great. His niece was like, "Oh, tell me about fasting," and had just kind of started fasting for weight loss, and was not a good situation. And that's not it. Thank goodness it didn't go too far, but that can definitely happen. So just watch out for that and be cautious.
Well, can I ask how long does he sustain that? Like, he brought down his A1C, but is it sustainable? I mean, is he still 2 years later?
Oh yeah, 4 years later, he's in the best shape of his life.
Good.
Yeah,
That's good.
yeah. So again, fasting is not the panacea, but it can be a piece in there that here's the thing though, Cindy Lou, he does all 6 of these. Like he's consistent with his meals. He's eating really good quality food.
I was going to say, did he modify his behavior so he didn't go back to his old habits?
Absolutely, yeah. He's made a sustained change, and fasting was part of the strategy that got him a really darn good result.
Right.
So,
is he still fasting now?
I actually haven't talked to him in a little bit, but the last time, I would advocate to him that once he got to a normal A1C and was able to maintain it, he probably didn't need to keep fasting. So, so yeah.
Andrew,
Yes.
in all of these cases you're talking about right now, you're talking about extended fasting, not intermittent fasting. Right?
Yeah. Okay. So good. So let's talk through intermittent fasting. Yeah, that is good that I am talking more about extended fasting. I would think of intermittent fasting as a good option for somebody that really wants to fight their insulin resistance or really wants to get off of medication or something. Intermittent fasting, I would do what I call either like, so let me transition. My favorite ways to sort of fast would be a modified intermittent fast or a modified extended fast. So let's see, is Pam still on here? Pam, can you talk a little bit about your, if we're going to go this way, we're going to go from fasting to modified fasting to modified intermittent fast. So Pam, will you talk a little bit about your 5-day fast mimic or 5 days? Yeah.
Well, surprisingly, I thought it was much easier. I was nervous about it.
Yeah.
I didn't think I could maybe do it. But the thing that got me through was that I just depended on God to get me through. I said, I need your help. I can't, I'm tempted by this and this. And it was awesome. And the thing that I had plenty of energy, I really expected I'd just be pitiful, but I wasn't. I went to the gym all 3 days that week, and it was, it was not difficult.
Yeah.
I think I was lucky that I was wanting to do it. I had a pretty good attitude, even though I was a little scared about it, but I felt good. I didn't, I just didn't have any problems with it. Matter of fact, I think you presented it to me to either 3 days or 5 days, see what you can do, see how it goes. And the 5 days was easy.
Yeah. And so to be clear, you did what we call a fast mimic. So you did 5 days of eating 7. I think for you, Pam, the number was 700 calories, and they were really good quality calories. So it was like buy organic, get the beef broth, get some greens.
Yeah.
And you got about 70 grams of protein or a little bit more each day. So so what I do is what I'm really partial to is people, if they really want to get that blood sugar or a medication or something under control, the way I modify it is it's higher protein, very nutrient quality meals, eating about 700 to 900 calories for 3 to 5 days. So it's not quite a full fast, but it's also, it's significant enough that you're definitely going to experience I mean, your glycogen is going to come down, your blood pressure is going to come down, all that kind of stuff. So one of my favorite things to do is not a 5-day full water fast, because it's a little bit just, to me, it's higher risk, less reward. We do something like a 3 to 5 day modified fast. Or Biff, one thing that I might do is, say someone's going on a diet and we cut, they start their diet, or they're maintaining at 2,000 calories, and say they're going to start their diet and go down to 1,500 calories. It might be just a completely easy way for them to organize their day, to just take out breakfast or just have a little bit of protein for breakfast, and then just do what they've kept doing through their maintenance. So in other words, lunch and dinner, their whole schedule stays the same, but breakfast, we just swap that out, maybe add a little bit of protein. So that could be a way to, you're kind of doing intermittent fasting. You're going to go 16 hours without a big jump in your glucose or glycogen. But it's not just gonna crash your metabolism. So one thing that may be helpful for you, if you're dieting and you're having a hard time staying under those numbers that I'm giving you, you might could adjust to like an intermittent fast where as long as you keep to your lunch and dinner portions, you can just kind of waltz through lunch or waltz through breakfast, and it's easier from an adherence standpoint. And I do think you're going to start getting better fasting blood sugar numbers. Your morning blood pressure is going to be a little lower, all that kind of stuff. So Biff, I would be totally comfortable with somebody maybe doing just kind of a small protein breakfast and just editing out that breakfast, if it makes it easier from a behavioral standpoint for them to adhere to their diet. Any other questions on that? Does that kind of help?
So basically, what diseases can you control through fasting?
Oh man, the literature is pretty powerful. I think there's good evidence for like the plaques, the tau protein that builds up for Alzheimer's, that can get cleared out during sleep and fasting. Any of the insulin resistance things. So blood pressure, blood sugar, PCOS is one that they can help with. There's some autoimmune diseases where fasting seems to help. And then there's actually some like bacterial and gut infections that fasting. Oh, that would be another reason why somebody could do a 5-day fast, Nancy, is like a gut issue that really, like, they've got bacteria that just needs to be starved out and purged.
Like diverticulitis or something?
Yeah, that's a good, or like SIBO, small intestinal bacterial growth. If you do an extended fast, on that 5th day, it will just be, everything will pass through you, and truly you will have a cleanse. You'll have a cleansing effect. And the minute you go back to food, you will need to be prepared. So it won't be much more descriptive than that. There's some evidence that food sensitivities can improve with fasting as well. So if you've got allergies or things like that. I've known some people that are like gluten-free before a fast, and after a fast they can eat gluten. I wouldn't say that's everybody. I would say that's probably an exception, but could happen. All right. Anybody thinking they might want to try it? It might want to be a good candidate?
I've kind of been doing a little modified version of it, but it's just really not eating until 11:30.
Yes. So Jane, you might be with you, Jane, where I think you're going to get your biggest benefit is for us to hit these basics. And once we do these and you're getting a little bit stronger and you're feeling better, and then we could see if going back to that might be beneficial to you. But, I think that's why I gave you the action item for 3 meals a day this week, correct? Or no, I just said track what you're doing. Yeah. So the next action item I'm probably going to give you is, hey, now don't do it yet, because I do want to see where you are. So don't let me change what you're doing. But the next thing I'll probably give you is, hey, let's just go to 3 meals a day, see how your body responds to that.
I have more questions, but that can be like for you and me call. I don't want to everybody's time.
I think if you've got it, somebody else has probably got it. I'd like for you guys to pepper me with any questions you have. So I don't mind if you don't mind. If people need to drop off, they're welcome to.
Well, this was a good example of something that happened to me today.
Yeah.
I didn't have lunch or breakfast because I got up and was doing like other things. And I take a thyroid pill. And so I have to wait at least a half hour anyway. And usually that's not a problem. But today I took the pill. I had been awake for a little bit longer, and I'm trying to figure out how many hours, but my blood sugar dropped so fast. I was like lightheaded, gonna throw up, just feeling, and my blood sugar does drop. So I know what it is. So I went and took a Dove candy because that was like the quickest way I could get sugar in.
Yeah.
And I was making my breakfast as the Dove was, kind of melting. And then I felt better. So I don't know how long I could go without eating, without feeling like I'm going to throw up and
like death. Yeah.
Hi.
yeah.
Okay. So you're a minority in that. So
Of course.
Yeah. If you miss breakfast, no, but not unheard of. It might be like a 30%. But, okay. So you miss breakfast, and then all of a sudden you're hypoglycemic, low blood sugar. Okay.
Yeah.
Okay. If I talk to 12 people, probably most of them would say, probably 11 or 10 of them would say, I don't eat breakfast because I'm never hungry in the morning. They're like, if you make me swallow an egg at 8 a.m., I'm going to scream for the hills. Yeah, that's probably more common than that. With that, Cindy Lou, that's interesting.
It happens when this isn't like, an isolated incident.
Yeah.
It happens, when I just don't stop myself and make myself eat.
Do you, does it ever happen during the day?
Sometimes, like if I'll eat breakfast and then I miss lunch, and then I'm out either walking or doing whatever, and then I'm like, I'm low, and my husband already knows, she's low. Like he can see the signs.
Oh, so okay. Now I can't diagnose you, so this is not a diagnosis.
Right. Yeah.
You may have an overactive pancreas, or you may just put out a good amount of insulin, more than what you need. This is not a diagnosis, but I have a colleague and friend who will, if she eats any carbs, her pancreas just goes crazy. So if she is like if she has a fry or like anything that's higher glycemic, like if she were to do white rice, she would crash and almost pass out just because her pancreas is secreting way too much insulin and it's driving her blood sugar really, really low. You may have just a little bit of some kind of genetic thing going on, or if it happens during the day, I would say that's pretty unusual, and that might be something else.
Yeah. Well, I could talk to Dr. Pardue when I see him next month.
Totally. I definitely would.
Yeah. Okay. Well, that's like when you were talking about all of this, I'm like, oh, this would be good. But just happened this morning, and I'm like, yeah, no way.
Yeah. Now, if this was not happening during the day and this wasn't something that you were dealing with for a long time, I might even have someone say like, hey, look, this is something that train your body to not like just crash in the morning if you can't eat, and I think that's something that some people could do. Like it's the same thing. People that aren't hungry in the morning to eat, they can train their body to eat in the morning, and they can bring back their hunger. That doesn't sound like something I would want to train you on. That sounds like there might be something deeper going on.
Okay.
Yeah.
That sounds good.
Yeah. And I would probably seek an answer to that.
Okay. Thank you. I never really thought of what it could be. I just figured, my blood sugar's dropping, but maybe I do have a problem with the pancreas. So
it's got a name. There's a couple of different things, but some kind of, there's like a couple of different kinds of like hypoglycemia disorders. Non-diabetic hypoglycemia is one of them. I'll look up a couple of things and maybe send it to you.
Okay, thank you.
Yeah. Anybody else? That is funny, Cindy Lou. I bet no one else on this call has that question.
You're right.
Hey, that's okay though.
I told you I should have waited for you.
Yeah, no, they're all still here. That's good. That's good.
Knowledge is power.
Yeah, exactly. We all learned something.
That's true. That's why this is like awesome, because I hear everybody's stories and, I can take from them what will work, and it's awesome.
Love it. Thank you for that.
You're welcome.
Anybody else?
I came in very late, so I don't mean to ask you to repeat something, but
That's fine.
how many sequences of fasting do you go through?
Yeah. So I would say, how is this for an answer? How about one and then reevaluate?
Yeah, fair enough. Yeah.
Honestly, I think that's kind of where I'm landing with this, is some people respond really, really well to it. Some people don't respond quite as well. Some people love it. Some people don't. So I would say, the biggest thing for you, Jennifer, would be, can you maintain your training during it? I think you could easily do anything from a daily kind of modified intermittent fast, where you're just kind of, it's a chance to, you don't have to worry about counting your carbs or anything, maybe get a little bit of protein in, to a 3 to 5 day fast mimic, as long as you maintained your training. Now that might just be, it might be like Pam, and you're like, hey, it was a great time for my prayer and spiritual health, and it was a great experience, and I did well. Or you might just be like, you know what, that's more than I want to bite off. But I will tell you, if you do that for 3 to 5 days, you're going to have a different perspective. You're going to have a different relationship to food, and you're going to be really proud of yourself. So I just think this is my last slide, actually, that I didn't show, is the religious fasting is almost all cultures, almost all wisdom cultures across the world encourage some form of fasting, at least for some period of time. So we actually generally are biased towards fasting, that it is wise to participate in some kind of fasting at some point, because all wisdom cultures do it, from the Greeks to the Egyptians to the Muslims to the Jews and Christians. So I think there's something there, although I don't necessarily always think it's going to get you fastest to the results that you want, if we're talking about weight loss or whatever. It's going to give you a new perspective on your health, on your journey, on what you can do. So that would be my pitch to you, like that, Jennifer, is if you're kind of on the fence, might be like, hey, try it, and I guarantee you're going to be more mindful of your health at the end of it. I'll say this. I don't know many people that have done 5-day fasts and then go back to eating McDonald's on the 6th day.
Here, here.
And on the 6th day, they did not eat McDonald's.
Yeah. And actually, I'll share a little bit of my story. I have always liked Taco Bell. I still like Taco Bell. Haven't had it in a really long time. But the thing that really freed me up from eating foods like that was part of my fasting journey, and just kind of cutting food out like that, and just had a bit of a change in my perspective. And it can take years for people to change their perspective on food. But fasting really helped change mine, and it was like 3 days,
This will get you off of Taco Bell. Go to the fair, get Taco Bell, and look at the nozzles for the drinks. They're covered in black mold. You will not eat at Taco Bell again.
Hey, I'm not drinking anything at Taco Bell. I'm just getting their burritos. Show me mold on the burritos and maybe I'll stop. No, I drove by the Taco Bell in my neighborhood, and I was like, one day that might get me. It's like, but not today.
That's awesome. Good for you.
Thank you. I appreciate that.
That's awesome. I still haven't met a sweet I couldn't eat, so maybe I do need to fast.
No. Well, so that is one thing, where if people are unable to say no to a food regularly, hey, let's try to either just giving that food up or giving up food. And when you've decided you're going to fast, a lot of times people aren't like, ooh, I'm not going to eat that, because they're like, no, I'm fasting. So,
Yeah.
All right, y'all. I think that's not all that we could talk about on fasting. You can get your PhD on any of that. But here, the takeaways would be, don't do it from a Facebook post. Don't see a Facebook post and, yeah, I'm just going to fast now. It's got some nuance to it. It's something that you should probably consider. it's not something you should consider for weight loss, but for spiritual development, for food freedom, for metabolic disease, it's something that absolutely you should consider. And as long as you can maintain these foundational behaviors, I think you can leverage it to your good, and not be set behind with it. So, all right,
Okay.
love it, love it.
So
Andrew, if everybody's done,